Please welcome Bloomberg Assistant Professor of American Health, Department of Health, Behavior, and Society at Johns Hopkins Bloomberg School of Public Health, Dr. Kiara Alvarez. Professor in Johns Hopkins School of Public Health, Medicine and Education, Dr. Holly Wilcox. And your moderator, Bloomberg Fellow and Public Health Reporter at Kaiser Health News, Aneri Pattani.
Thank you, Holly and Kiara, for joining us today to talk about this important topic. Over the past few decades, we've seen an increase in thoughts of suicide, suicide attempts, and unfortunately suicide deaths among many youth of color, including Latinx youth. Kiara, could you talk to us a little bit about what are the concerning trends that we're seeing and what are some of the factors that might be behind them?
Absolutely. So one of the challenges that we see is that we have this idea that suicide risk peaks in middle age. We've heard that statistic. But when we actually look at subgroup differences for people of color, the risk actually peaks in adolescence and in young adulthood. And so it's a different pattern that really speaks to the need for early intervention. And at the same time, we see these massive disparities in the kinds of mental health care that youth of color are getting. And so including for Latinx youth, we see the lack of access to preventative care and to mental health care when there is suicidal ideation and behavior. But we do see that there's a greater likelihood of then receiving services through emergency departments or of being funneled into punitive systems, school behavior concerns, as well as the juvenile justice system. And so without addressing those inequities and understanding what the underlying factors are, it limits our ability to engage in effective prevention. And for Latinx youth specifically, there are barriers for particular groups, including language access, low rates of insurance in many states, and the lack of culturally competent care available to families.
Yeah, I really appreciate you comparing when we have different risks, different populations, there's different risk factors, and therefore our policies have to address different issues as well. So Holly, I'm hoping you can talk to us a little bit about, there are policies that are being tried at state and national levels to address this issue. What are some recently passed ones that are trying to address youth mental health and suicide prevention, and how do you think they might affect Latinx youth especially?
Sure, I'm going to focus on some policies that are in the public health realm. And one of the barriers that we face in the field of suicide prevention is getting evidence-based practices out to those who need them, when or before they need them. And so there's a great policy that, or law that was passed in California. It's Senate Bill 224. In California, about 40% of the state is Hispanic. And so it will benefit lots of youth. And the idea is that mental health education will be embedded within health education for students in grades 1 through 12. So students will get developmentally timed mental health education in elementary school, then in middle school, and then again in high school. And they'll receive it by trained, highly qualified implementers or instructors who will deliver the training. And the whole idea, another idea behind this training is it will be given directly to students, but also that, that it will be appropriate for a diverse student population, diverse by gender, diverse by race and ethnicity, by gender and sexual minority status, students with disabilities, and English language learners, which are, those students are often excluded from our traditional suicide prevention interventions because of difficulties schools have with having a Spanish-speaking implementer and pulling students out and so forth. And so I'm excited about this momentum that we have a silver lining in the pandemic. Another is the Stand Up Act, which is a national law. President Biden signed it in March of this year, and it is a suicide-specific policy that will enhance the ability to bring awareness and prevention to students in schools, grades 6 through 12. It focuses on, it's actually implemented through the Project Aware mechanism through SAMHSA, and so states and local education authorities and tribes will have additional funding to support suicide prevention evidence, and students will get it directly. In the past, there was a lot of effort on focusing on training adults that work in school buildings, and unfortunately, that hasn't shown to have the research impact that we need to achieve to make a difference. And so the direct provision of the intervention to students is the idea behind this law, which is evidence-based, which is fantastic. And also, the Bipartisan Safer Communities Act has some additional funding built in for continued dissemination and enhanced dissemination of this Stand Up Act.
Yeah, I love the emphasis on training students. We heard Attorney General Shapiro earlier today talking about how students are, the ones who often know when someone is at risk. So that's wonderful to hear. So I want to ask you both to pick, I know it's hard, but one intervention from your research, from all your expertise on this topic that you think is really promising, that is in the field right now to address youth mental health and suicide prevention.
Sure. So I think one thing that's important to take into account when thinking about these interventions for Latinx youth is just the incredible diversity of the Latinx community in terms of race, ethnicity, in terms of thinking about vulnerable subgroups that we often don't know that much about in terms of our national data. And so thinking about immigrant youth, LGBTQ+ Latinx youth, Afro-Latinx and Indigenous Latinx youth, which is something that can really be addressed most effectively on the local and community level, because communities can really understand the demographics and the needs in these particular groups. And so an intervention that we work on and are really looking to develop further is around integrating community health workers both into community and primary care settings, really leveraging the strengths of people who are embedded in their communities, serve as community leaders or trusted providers who can then support clinicians and other health providers in delivering better care both to youth and their families who often need additional help navigating the mental health care system. And at the same time, there are a lot of challenges to be addressed to be ensured that we create a role for community health workers that is actually a beneficial role for them as well as employees within the healthcare system, that we don't replicate inequities of low-paid providers that are put at a different level in the hierarchy in healthcare. But I think there's a lot of promise to really harnessing the strengths in communities and among families to be able to engage in more effective suicide prevention.
Absolutely. And Holly, an intervention that you're excited about?
Well, it's clear to me, I've been in the field for a long time of suicide prevention, it's clear that we have to attack this problem from multiple angles and perspectives, and we need better coordination. The 2021 suicide mortality preliminary data is available, and we're now up to 55% of suicides were by firearm. So there's definitely, that would be one area where we could make a great deal of impact. But I think this idea of also coordinating better across funding streams and about people and with people in various disciplines to have a more coordinated and multi-pronged approach would be my ask.
Absolutely. Well, it's great to hear there's a lot of promising ways we can move forward. And we've been talking a lot about Latinx youth specifically, but as we started the conversation, suicide risk is rising for many youth of color. So I'd like to invite Dr. Allison Barlow, Director of the Center of Indigenous Health, to share with us her work tailoring interventions for youth suicide risk in Native American communities. Allison, can you tell us a little bit about what your work in youth suicide prevention looks like?
Yes, thank you, Aneri. There's nothing more devastating than a loss of a child to suicide, to a family or community, and we have to feel that in our hearts to do better. Native American youth ages 10 to 24 have had the highest suicide rates in the United States for 4 decades. Suicide is a direct result of generations of racialized trauma that started with colonization. COVID has exacerbated suicide deaths. Native youth now suffer 3 times the rates of suicide than all other U.S. racial groups. Our work with the White Mountain Apache tribe shows there's hope and there's solutions. Over the past 3 years, it has led to the first of its kind tribally mandated suicide surveillance and case management system staffed by local Apache mental health specialists. We've been able to document over a 6-year period before COVID that the system reduced suicide deaths by 38% and attempts by 53%. In addition, through the Bloomberg Initiative, my colleague, Dr. Emily Harrows, sitting behind me, has led our work with the Apache colleagues to develop a highly accurate machine learning tool connected to emergency department data to help flag youth at highest risk. This tool embedded in the surveillance system helps us get to youth most at risk faster. With Native youth suicide on the rise, this work is urgent, and there's much to learn from the frugal innovations that are being discovered by Indigenous peoples. Thank you to the initiative for focusing on ending suicide disproportionately affecting youth of color.
Thank you very much, Allison, and thank you, Kiara and Holly, for having this important conversation with us today.